Yeah.
All right. Well, my name is Stephanie McKee. I am a physician assistant in family practice at Avera Carlson Clinic, and I have been here for about 15 years now. I was born and raised in Marshall. And then came back here after graduation. I had worked a few different places after graduation, and then just decided to come back to the Marshall area as this was home, and they were in desperate need of family practice providers. So today we're going to talk about just kind of physician assistant, what kind of led me down this path, and kind of the day in the life of what I typically do in family practice. So graduation is kind of overwhelming. I remember graduating from high school thinking I definitely want to go into medicine, but I wasn't sure what piece of medicine I wanted to go into. And so originally when I went to school, I went with a biology degree as well as a chemistry major. I ended up not doing the chemistry major. I did a chemistry minor and a psychology minor because I felt like that might be more helpful in what I wanted to do. So I had a major in biology with a minor in chemistry and psychology. So going to our next slide here. So what are you going to do after graduation? Everybody is always asking you that. Big thing is just do what you're going to love doing for sure. And there will be days that you wonder if you made the right choice. Hang in there. So again, a little bit about me. I was born and raised here in Marshall, went to Briarcliff College, then went on to PA school in Rosalind Franklin, which is in North Chicago. I practiced at the Roya Family Medicine Clinic, which was about 99% Hispanic only speaking population, and was there for about 6 months, and then moved back to the Marshall area. And I've been at Avera Medical Center, Marshall, about 12 and a half years. I've done pretty much everything. So people always ask, well, do you have to have a lot strong work history? I think your work history has to be that you have to have a good work ethic and you have to be willing to do anything. So as you can see, I've pretty much done anything and everything. I've lived in a lot of different places. So people say, why would you move back to Marshall, Minnesota? Most kids can't wait to get the heck out of town. And I did go out of town, and I've lived in some really great areas. I've lived in some pretty horrible areas. I worked in Flint, Michigan for a while, and just decided that Marshall was probably where I wanted to come to raise my family and to live. But one of the best experiences, Hurley Medical Center in Flint, Michigan. As you can see, the fence, very, very rough area, very awful place for people to have to live. High drugs, high gangs, high shootings, but awesome opportunities as far as training. So I encourage people to try to go out of your comfort zone, out of your box, because sometimes those are the best places in which to learn. So objectives today are just to tell you kind of a little bit about the history of physician assistant, education, responsibility, salary, a day in the life, and then we'll take some questions after that. So PAs or physician assistants originally developed out of a military model. So medical professionals that were coming back from World War II, med techs, were highly trained individuals, but they didn't have that more formal education from medical school. But if you've been to the front lines of any kind of war zone, you've done a lot of things because you are a set of hands and you are our only option at times. So we had these highly trained individuals from the military that really needed to not go back to 4 years of medical school and then 3 to 4 years of residency and then possibly another 2 to 4 years of fellowship. And so they needed a model by which they could formally train these medical providers that came out of the military, and hence physician assistants were born. So mid-1960s, we had this huge shortage, and Dr. Eugene Stead of Duke University recognized that we have a ton of these Navy corpsmen, military personnel that have had this field training that is by far invaluable. And so we need to figure out a way of fast tracking these providers to get them into a formal medical provider situation here in the United States. So curriculum was based for a fast track training of quote unquote doctors. So what does a person need to be a good PA? Like I said, a strong work ethic, willing to go above and beyond, willing to work as a team, a desire to serve the community. Healthcare experiences is great, but again, you're going to get plenty of training when you get to school. So again, the more life skills, the more life experience you have, the better, I think, you do as far as PA school is concerned. There's currently over 255 accredited PA programs. A lot of these used to be just a kind of a bachelor's program. And now most of them, I think as of 2021, need to have their curriculum updated to obtain a master's degree. So the certification and licensing, you need to pass the NCCPA, which is a certification exam. Anybody that comes out of PA school is considered a physician assistant. However, in order to actually bill insurance and to work typically as a PA, you need to be certified. And so that's where the NCCPA certification exam comes in. And then typically every state has a little bit different licensing, may require a specific state license exam. But as long as you have that national certification, pretty much most of the time it's just really applying for a license through whatever state you may be working in. Then we talk about the PA education. So the curriculum that I went to at Rosalind Franklin was a 27-month curriculum. We started the end of May, the last 2 days of May, and we ran through 2 years, May of 2000. And so most curriculums are approximately 27 months or 3 academic years. The program I went to was a 24-month curriculum whereby the first year was all done in the classroom. And the second year was all done as a didactic year where we're doing more hands-on training, rotations, and that kind of thing. So like I said, 255 accredited programs, and some of them are working towards that accreditation. But by January 1st of 2021, all of them need to be a master's degree because, of course, you have to have a bachelor's in order to get into most PA schools at this point. So the difference between, people often say, well, what's the difference between a nurse practitioner and a physician assistant? Are you under a nurse practitioner because they are a practitioner and you are only an assistant? Honestly, the training is a little bit different. So with a nurse practitioner, they usually have to have a bachelor's in nursing or their RN, and then they will go on to get their master's or even a doctorate with their nurse practitioner. With the physician assistant model, we are actually trained in the medical model, so more like physicians. We are actually trained with physicians. In fact, that's where I met my husband, who is a physician. But we are actually trained more in the medical model, whereas nurse practitioners are trained more in the nursing model. We do virtually the same thing, a little bit different in the fact that for nurse practitioners, if you are specifically trained in your field. So if you are a nurse practitioner that does family practice, you need to stay in family practice. You're not allowed to necessarily go into pediatrics or orthopedics. Whereas with physician assistants, I have worked in urgent care settings. I have worked in family practice. Now I'm doing a little bit in wound care. I have that kind of more well-rounded where I can kind of float. And I did that specifically because I wasn't sure where I wanted to live and definitely did not want to get into a situation where I was having to drive an hour to get to work because that was the closest job available. So with my education, I feel really comfortable and confident. If I needed to, I could go into surgery. And I have a lot of my classmates from PA school that are in surgery, OB, cardiothoracic service lines, or pediatrics, endocrinology. and we were all trained the same way. So there's a lot of opportunity. Like I said, anybody that graduates is a physician assistant, but until you get the certification, CMS, which is the main billing of our insurance companies, won't recognize you as a provider, and so therefore whatever company you're working for isn't going to pay you, which is always a problem. So next, PA education, like I said, so once you graduate, you take your certification exam. The NCCPA requires you to do 100 hours of continuing education, reading journals, helping to teach others, that kind of thing. Typically, we need to have those every 2 years. There's a lot of change occurring. Obviously, the current pandemic has made us look at a lot of those things. Typically, right now, states are requiring every 2 years, 100 hours of continuing education. The recertification exam now that we have to take is every 10 years. So that too is a little bit different than the nurse practitioners. Once you obtain your nurse practitioner license, you don't have to recertify. Physician assistants do, and again, that's kind of something. It used to be every 4 years, then was every 6 years, now it's every 10 years. So who knows in the next few years where that will be, but right now it's every 10 years. There are now some specialty distinctions, so if you want to say that you're a surgical physician assistant, there are residencies that you can go to get some extra training in that regard, and actually fellowships, but there's also some specialty examinations that you can take just to put a few extra letters behind your credentials. So it's an up and coming thing, and I think as we look at the shortage of healthcare providers that we're having, our goal is to make sure that we can get more healthcare providers, but obviously responsible and knowledgeable healthcare providers into the workforce. So typical classes that a PA student is going to take, you're going to take anatomy and pharmacology, clinical laboratory sciences. That's basically what tests should I want run in order to make diagnosis. You're going to look at a physical exam. A lot of times we look at a patient and we can tell by just seeing them, by looking at them, by palpating or putting our hands on them, what might be going on even before we order any kind of labs. Ethics, what is medically ethical. That's something, again, that we talk about with our current pandemic. If we have patients that are coming in with that are past a certain birth date and they have multiple medical problems, and I have another patient who is 30 years old and they both need ventilators, who do I make that decision to put on a ventilator if I only have one? Physiology, how does the body work? Behavioral sciences, we see a lot of behaviors right now, kids acting out because they're stressed and they're worked up, patients having severe stomach pains, chest pains because they're having severe anxiety. The body is a wonderful thing, but everything is interlinked. So looking at those behaviors and what we might be seeing if a kid is acting out, maybe they're just in a really bad situation at home, maybe they're extremely sad and they don't know how to verbalize those things. Pathophysiology, so looking at how cells are changing and how the changes may be causing problems for patients, whether it's a skin lesion, whether it's some kind of a pathology report from a uterine biopsy or a breast biopsy, what those cells look like and what they could mean if we leave those alone. Microbiology, so again, all of the various infections, viruses, parasites that can affect our bodies, and then the differential diagnosis. So if somebody comes in with a fever, what are our possibilities of infection based on a patient's age, based on where a patient lives, et cetera. Next, clinical rotation. So as I said, my first year was spent in the classroom, 8 to 5, taking all of these different courses. And then the second year was our clinical rotation. So typically you're going to do probably a 6 to 8 week, it depends on, again, your school and what their requirements are, of family medicine, pediatrics, emergency medicine, internal medicine, general surgery, psychiatry, obstetrics, and then specialties. So the specialties, I was in 2 specialties. Again, I worked at Flint, Michigan. And so I was there for 8 weeks and I did a emergency trauma rotation. And then I also did one in infectious disease, working with a physician in Hawaii who is one of our world-renowned infectious disease doctors with HIV. So you will find in your journey that you may have a passion for things that perhaps your colleagues or your family members may not. So word to the wise. This actually happened to me at Thanksgiving with my family. So other questions that people always have, tuition. So what is the cost of all of this? Schooling, as we know in college, is always in the back of our mind. How much is this going to cost? How are we going to pay for this? So there is a huge spectrum of PA schools. And unfortunately, unlike colleges, there's not a lot of reciprocity. So if you're going out of state, you're going to pay what an out-of-state kiddo would. If you go to a private school, you're going to pay a lot higher amount of tuition. Typically, these are usually in the form financed in the form of student loans, to be honest. Like I said, when I went to PA school, it was 24 months of very intense 8 to 5 classroom or 8 to 5 on the job. And then you went home and you studied and you researched and were writing papers and working on your master's thesis kind of thing. So the average, I would say, would be about $80,000. That seems kind of low right now. I would say when I graduated, it was probably close to $200,000, because then on top of that, you also have your living expenses, because it's not necessarily possible to work as you're going through PA school because the amount of information that you are taking in. We always used to joke, PA school is like taking a drink of water out of a fire hydrant. It's just a lot of information. And so you could drown quickly if you're trying to finance your living expenses by working. Your primary objective should be getting that good education and getting your knowledge base solidified. So ranking. So the big thing I tell patients or students that are looking at PA school is look at their pass rate. You know, you're going to get the same education regardless of where you go, but you want to make sure that you're getting the right information. And so if the amount of information you're getting is not appropriate to pass what's called the PANCE test, and that's your certification exam, and the pass rate is down at like this 59%, run, go somewhere else. That's not a good pass rate. You want to be somewhere in those upper 90s to 100% of their classes passing. Every student passes the first time, because there again, that test is about $1,000 to take. So where do you work? So after physician assistant, I would say the majority of us are probably practicing in specialties, working with orthopedic surgeons, cardiothoracic surgeons, general surgery, endocrinology, those kind of areas. A PA will usually change specialties about 2 to 3 times throughout their career. So primary care is about 32%, working family practice, internal medicine, but surgical subspecialties definitely are starting to take up a lot of APPs, advanced practice providers, physician assistants, nurse practitioners. You can find us working in hospitals, clinics, skilled nursing facilities, home care, medical homes. So again, the benefit here as a physician assistant is there's no extra training. If you decide to move, like I move out of Marshall and decide to move to California, I could go into orthopedic specialty. Might be a little bit of a learning curve, but I could do that without having to go back to school to get further training, which is nice. So employment by states, and again, this is the most up-to-date that I could find, May of 2017. So you can see some of the more populated areas definitely have a lot more physician assistants. So you talked about the East Coast, New York, Pennsylvania, West Coast, California, but Minnesota does have its fair share as well. North Dakota is just too cold. Nobody wants to live there, so. And then, so based on where you live, kind of tells you a little bit about your pay too. So you can see in Minnesota, we get a pretty good pay, very similar to what we would have in New York, California, Washington, Oregon area. Iowa is going to be a little bit less, but then you also have to look at your cost of care and licensing. So some of these states, the licensing is just astronomical, and cost of living is extremely high. So again, that's where Minnesota has some draw there, but North Dakota does as well. And then PA is in urban versus rural areas. So 83%, I think you're going to find pretty much in the metropolitan areas. Only a small number of us are out in these rural areas, but we truly love it. So that's why we're here. I will say that the practice is a lot different. So me being here in Marshall, Minnesota, I have my own individual family practice. So I have a supervising physician, Dr. Hill, who I go to with questions, concerns, and quite honestly, most of us will go to whoever, that's that collegial team that we have. But in the more urban areas where a lot of my PA classmates work, they work under maybe one or two physicians and helping them manage their practice. So again, kind of depends on where you live and where you practice as far as what your practice is going to look like. And that's all something that you just consider once you get out of PA school. Where do I want to be? What kind of practice do I want to have? And then my collaborating physician, what do they look like? What do they do? Because you want to work with somebody that you work similar to and well with. If you don't, life gets really, really hectic and frustrating, which is part of the reason I moved from Chicago. The site physician that I was working with, and I worked very, very different, and that became more and more of an issue as the time went on. So physician assistant graduates working in primary care, underserved in rural areas. So obviously out here in the rural areas, we really struggle to get providers. Obviously, I was born and raised here, so there is a pull here. My parents still live here, but if I have never lived out in Marshall, Minnesota, this would be a huge culture shock. I am not used to driving 2 hours to find a decent shopping center. I am not used to not being able to just pick up and go out for a nice dinner or go to a theater or a professional sporting event. So it is a different way of life. Working in primary care, you can see it had increased in 2012, and then it started to kind of back down again. I think it's starting to come back around, though, that PAs working in primary care is starting to increase again. But those rural areas are still really struggling. We still struggle to get providers back to the area. A lot of times if you get providers, you end up losing them after their contract is up, which is difficult for our community too. So PAs and specialties, like I said, we can work in a lot of specialties. You can see that surgical specialties seem to take up a lot of us. Emergency medicine, but I will say emergency medicine is a very high burnout. It has a lot of Hollywood notoriety with, Chicago Hope or ER, all of these like television shows and that kind of thing. But the glamour wears off really quick. I will say that in working 8 weeks in Flint, Michigan, I saw a lot of great things. I saw a lot of kids that died. I'm blessed and I'm grateful that I got to train there, but I don't think that I could live there with my family. And I remember being there just for 8 weeks, and I would see some of the same patients 2-3 times in just that 8-week period coming back to the emergency room. And again, some very, very ugly things. So I definitely enjoy the continuity of family practice, getting to see patients when they're well, encouraging them and educating them and coaching them on how to stay well. And emergency medicine does have its glamour. It's nice to what they call treat them and street them. But there is something to be said about keeping people healthy and not continually patching them up and sending them on and then having them come back too. So PAs by practice. So here again, rural clinics are really struggling. Hospital systems are definitely eating up a lot of the mid-levels. They just have a huge patient population that's coming in, and they need a lot of these providers. But again, rural clinics, the community health centers are those that are desperately seeking providers. Solo physician practices are starting to open up a little bit as far as having APPs, and then group practices. So we have quite a few group practices as well that will have a number of physicians and then have 2 or 3 APPs or advanced practice providers underneath of them to, again, bring in more patients, see a lot more patients, but also have a physician provider on staff too. In government, again, this is where we started. You can see that state government does have a lot of advanced practice or physician assistants there, but again, a lot are more going into the, I would say, the private practice and the public practices. So salary, everybody wants to get paid, right? If I'm going to take out all these loans, where am I going to get the most money? So again, recognizing that ER looks great and that's the highest paid, and people are going to look at that and they're going to chase money and they're going to burn out and be done practicing within a few years. And I've seen that happen a number of times. Don't chase money. You will be able to pay your bills when you get done as long as you are financially responsible. Do what you love. Do what you could do day after day for years, because again, if you go into medicine, of any kind of medicine, whether that's physician, nurse practitioner, physician assistant, if you go into medicine to chase money, you will find that that will not last very long, and you'll get wiped out pretty fast, because medicine is both physically, spiritually, and emotionally draining at times. And day in, day out, you give a piece of yourself. So you need to go in it because you have a passion for it and because you love what you do and you love helping people. Don't go into it for money, because you will become burnt out really fast. So responsibility. So what do I do in a normal day in my job? So obviously my job has changed a lot in the last few weeks. So going back to pre-COVID and coronavirus, typically on a normal day I would do physical exams. So I would do general wellness exams for women, for kids, for men, diagnose and treating illnesses, ear infections, strep throats, shingles, write prescriptions, order medications, home care supplies. Like I said, I do wound care as well, so ordering dressings, doing wound debridements, ordering and interpreting labs, suturing, splinting, casting, assisting in procedures. I've assisted in surgery in the past, providing patient education and counseling, rounding in hospitals, nursing homes. So those are all pretty typical of responsibilities. Again, changes a little bit depending on where you are and what your practice is. My typical day, I see probably about 20 to 25 patients. In family practice, again, annual exams, cough and colds, fractures, sprains, strains, lacerations, mental health. Pretty typical day for me. So just some things that I've seen in the clinic. These aren't my patients, but pretty typical of what I've seen. So shingles on a patient, casting, fractures, ear infections, kiddo with ear tubes and infection, again, more lacerations, pneumothorax, so picture of a lung that has actually collapsed because of air within the pneumo cavity, putting in chest tubes, again, great place in Flint, Michigan to be able to do those. Wounds, so I see a lot of these, foot wounds, diabetic patients that have no feeling in their feet, so they actually have no pain here. Nursemaid's elbow, so kiddos that will be holding parents' hands and then throw themselves down on the sidewalk to throw a fit, and mom or dad didn't let go, can dislocate that ulna, and so resetting that pretty easy, pretty quick, and done in the office, and the kid walks out smiling and giggling. And then, like I said, hopefully at the end of the day, you get to a where you have a good quality of life. Choose your practice wisely is the best advice that I can give. Choose where you live based on what you want outside of work, because work can be very stressful and very draining. It's wonderful. I'm extremely happy and I'm blessed to be a provider. But again, if you go into it for the wrong reasons, you burn out really, really fast. And you have to have that good balance between work life and where your family is going to be happy. This is actually a picture of Hawaii when I was rotating down there as a student on one of our days off. So, and that is about it. Like I said, make sure you make a good choice.
Awesome.
Any questions?
Well, you answered a lot of the questions that we have. Goodness, that was an awesome session.
Oh, good.
Let me see if I have any questions that, would you say that there are more women or men that are in, or minorities? Would you say that there's like a lack of minorities as a PA, or lack of women or men, or what would you say,
you know, I would say so my PA class, and again, we live in Marshall, Minnesota, so that's oftentimes hard for me. When I went to PA school, I would say our PA class was probably maybe 2/3 women and 1/3 men, but I've seen that changing a lot with recent graduates as well as students coming through. As far as minorities, again, I think it's probably typically Caucasian, but again, I think as word gets out that this can be done, that it's not 4 years of medical school and 4 years of residency, I do think that there's been some real improvements in getting minorities into the profession as well. And I think you see a lot more of those on more of the coast, down in Texas, that kind of thing. I will say that, so things that I have found helpful in my practice is my Spanish that I had in high school. Being bilingual has been huge. So when I went to PA school, I think the vast majority of us, there was 50 students in my class, a lot of them at the time when I went to school were business majors, athletic trainers, teachers. So we came from a very wide variety of education. So a lot of kids will go into college and they go into biologies and chemistries, and you can do that, but you're going to get a lot of that in PA school too. So sometimes it's good to have those that business degree or that HR degree, sociology degree, to know how to deal with different populations, different cultures, teams, that kind of thing.
I think a lot of times students, you've talked about, the glamour of the $110,000, and then they go off and they do it in New York, but they don't realize that the cost of living is so extravagant.
Oh, it's crazy.
Versus, being maybe in rural Minnesota, it is fun to go off and do all that stuff, but as they go to school and they realize the cost of living, it's actually, they're going to probably get more bang for their buck being in a more rural area.
Yep.
And, we've got great small businesses. We've got Amazon.
Yeah,
but
it's true. When I practice, people see that picture of Hawaii and they're like, why are you back here? Are you crazy? I am kind of crazy. But when we lived down in Hawaii, quite honestly, the only reason that I could live down there, it was $3,000 a month. We had a 1-bedroom apartment that myself and another girl shared. And the two PAs that we worked with down there, both rented $5,000 a month for their homes. I mean, they couldn't afford to buy a home down there, even though they were paid well. And I'm like, that sucks. I don't want to have to rent the rest of my life, but there again, they were happy. They loved the ocean. They loved being on the island. It was a good fit for them. But a quality of life. And my husband and I, my husband is from Chicago. And so he too says, when I worked for 6 months in Chicago, it took me 2 hours each way to go 10 miles every day, 4 hours of my day that I'm never going to get back. it was just crazy. I was like, I can get in my car, I could get on my bike and be to work in 10 minutes here. And you know what? For the amount of extra time that I have, how often am I going to go to a professional sport game or have time to go out for a nice dinner? I have 4 kids. That's not going to happen. So, I mean, I can drive to Sioux Falls or to the cities and have a nice weekend and save myself the money and have a bigger house. My brother and sister say that they live in the cities. Wow, you'd never get a size house for this kind of money in the Twin Cities. You'd pay, you know, this amount of money for it. And it's like, that's crazy to me. Why would I do that?
Right.
But they love it. They love it. So
Yeah.
it is about your work-life balance. I love being outside. I love that my kids can be outside and I know the people around me. And I love the fact that they can be in a lot of these outdoor activities that I couldn't be able to do in the cities because I wouldn't get home until 6:30. And I'm
Right.
paying for daycare from 7 to 6:30 and that kind of thing. So, yeah,
Right.
again, that's where that change, you know, where they say you'll change about 2 to 3 times in your career, because your life does change. When I was in college, when I was single, yeah, that had a lot of glamour, living in Chicago or living in Dallas. But again, as you start to look at settling down, having kids, you have to look at where your balance is. Do I want to, you know, have a nanny that raises my family, or do I want to be able to spend time with my kids and have dinner with my family and have breakfast with them and that kind of thing?
Right. No, that's awesome. Well, thank you so much, Stephanie, for
You're welcome.
taking this
If
time.
they have questions, if they have questions, Audra, you have my phone number and email.
Yep.
Please feel free to hand it out. I can definitely talk to people more as well if they have further questions.
Okay, great. Thanks so much.
Good luck. Have a great day. Take care.
Yeah, you too. Bye.
Okay. Bye.